But I want to build on what Jonathan said. Jonathan pointed out what happens, the consequences of doing nothing if you happen to lose your health insurance, lose your job. But even if you maintain your health insurance, the status quo is a disastrous result. If you maintain your health insurance, you're going to see your health costs double over the next decade with the current system in place, about $25,000 for an average family of four to pay for their health care costs. If you feel, as I do, that we've got to be concerned about the federal deficit is going to go way over the top and explode the nation if we can't drive our costs down around Medicare and Medicaid. So whether the concern is around coverage, as Jonathan pointed out, or my concern around making sure that we've got a financially stable system, the status quo is a disaster.
During your recess, you're going to get on to Southwest Virginia, which is not necessarily a friendly place for Democrats. You're going to be walking down Main Street in Tazewell, and people are going to be asking you, what's in this thing for me? How are you going to sell it down there?
Well, Lawrence, I was just down in Southwest Virginia this past weekend. I had a town hall, a telephone town hall of 4,000 folks. There's a lot of misinformation out there. There's a lot of misinformation about taking away your health care or some government bureaucrat in between you and your doctor. Unlike, as if there's not some kind of insurance bureaucrat in between you and your doctor already. One of the most egregious things I've seen in my whole political life, though, was what took place in the last week or 10 days. I, for example, have got a bill around the issue of end-of-life discussions. How do we make sure that seniors and their families got a chance to have that kind of discussion, have all their choices available to them, have that chance to sit down with their minister or priest or rabbi and talk through these issues, and then to see some of the outrageous scare tactics played by some of the anti-reform folks out there saying that somehow healthcare reform is going to limit seniors in their choices or lead to euthanasia. That is beyond the pale. I've never seen any kind of tactic like that in my 20 years around politics.